morning, I'm Dr. Gonzalez. How are you today?
Fine, thank you. How are you doing?
Good, thank you. Well, just a little bit about myself. I graduated with my Bachelor's of Science from Baylor University, and then I went on to graduate with my medical doctorate from Baylor College of Medicine. From there, I did my internal medicine residency and my endocrinology fellowship at Graceland Memorial Hospital. So what brings you in today?
Well, lately I've been feeling a little tired, and I've noticed that I've lost a lot of weight even though I haven't changed my diet or been working out more than I usually do.
Mm-hmm.
And I've been a bit anxious to the point where my hands kind of shake and it's kind of freaking me out. But yeah, I'm having trouble sleeping at night and stuff, so I was just wondering what's going on.
Okay, well, tell me a little bit about your medical history.
Well, I have a history of high cholesterol. That started when I was young, and then my mom has Graves' disease.
Okay, well, according to your symptoms and your mother's history of Graves' disease, I believe that you also have Graves' disease, which has led to hyperactivity in your thyroid gland, which leads to hyperthyroidism. However, in order to know for sure, I'd like to get a blood sample in order to measure your levels of thyroxine and TSH in your blood level. Okay, well, the tech will come in shortly to get that blood sample.
Thank you.
Hello, my name is Cole Cuno, and I'm your lab tech. A little bit about myself. I have my associate's degree from Thomas Edison State University in medical laboratory sciences, and I'm going to be taking a blood sample real quick to test for the TSH in your blood.
Sounds good.
Okay, I'll be right back with the results.
Thank you.
So the blood test results are back, and it turns out that you do have high levels of TSH in your blood, indicating that you probably have hypothyroidism.
Okay, so I'm actually in nursing school right now. Could you explain to me a little bit more specifically what that means for me as far as what's going on?
Okay, yeah, sure. So the rate at which T4 and T3 are released into your bloodstream is controlled by the pituitary gland and the hypothalamus. And here's kind of how the whole process works. So the hypothalamus signals your pituitary gland to make a hormone called TSH, what we talked about earlier. And your pituitary gland then releases TSH, but the amount depends, and the amount that it releases depends on the levels of T4 and T3 in your blood. So if you don't have enough T4 and T3 in your blood, your TSH rises. If you have too much T4 and T3 in your blood, your TSH falls. And so since your diseased thyroid is constantly producing TSH, it is constantly being released in your bloodstream, resulting in high levels of TSH in your blood. Your doctor will be back in shortly to talk with you again. But it was nice to meet you.
Me too. Thank you.
Hello. Okay, well, do you have any more questions for me before you head out?
So the lab tech explained a little bit about it, but I was wondering more cellularly what's going on inside my body.
Okay, well, the TSH binds to receptors which activate adenylate cyclase and elevate CAMP concentration levels. And because you probably have Graves' disease because of your results and your family history, you have autoantibodies within you that bind to and activate the TSH receptors. So this leads to continual stimulation of the receptors, which leads to the overproduction of the TSH hormone. And so because of this overproduction, that's why you're experiencing the quicker heart rate, the faster metabolism, and your insomnia that you're having.
So what are some of my treatment options?
Well, the most effective treatment is going to be anti-thyroid medications, and these medications will gradually reduce the symptoms of hyperthyroidism by preventing your thyroid gland from producing the excess amount of hormones. The symptoms usually begin to improve within 6 to 12 weeks, but treatment with anti-thyroid medications typically continues for at least a year.
And what are some of the side effects of the medicine?
For some people, there are no side effects because they clear up the problem permanently, but other people may have a relapse in the hyperthyroidism. And a small number of people who are allergic to either of the medications can become more susceptible to infection, or it develops skin rashes, hives, fever, or joint pain. And there's possible damage to your liver.
Okay, so I guess could you have my prescription sent to the CVS on Blanco or Keeper?
Of course. Well, thank you so much for coming in. See you soon.